Understanding dyslexia. Dyslexia is a neurological condition that affects a person's ability to read, write, and spell accurately. It is a learning difference that can cause difficulties with language-based processing skills, such as phonemic awareness, decoding, and fluency. Dyslexia is not related to intelligence or vision, and it can affect individuals of all backgrounds and abilities. People with dyslexia may have difficulty recognizing words, reading aloud, spelling, and comprehending written text. They may also have trouble with sequencing, organization, and time management. What causes dyslexia? The exact causes of dyslexia are not yet fully understood, but research suggests that it is a neurological condition with a genetic basis. There is evidence that dyslexia may be linked to differences in brain development and function, particularly in the areas of the brain that are involved in language processing. Some of the possible factors that may contribute to the development of dyslexia include: 1. Genetics. Dyslexia tends to run in families, and there are specific genes that have been linked to dyslexia. 2. Brain development. Differences in the way the brain develops and functions may play a role in dyslexia. Studies have shown that people with dyslexia may have structural and functional differences in certain areas of the brain. 3. Environmental factors. Certain environmental factors, such as premature birth or exposure to toxins during pregnancy, may increase the risk of dyslexia. Dyslexia is not caused by lack of intelligence, poor education, or cultural differences. It is a neurological condition that affects the way the brain processes language. Symptoms of dyslexia. The symptoms of dyslexia can vary from person to person, but some common signs include difficulty reading, poor spelling, writing difficulties, difficulty with phonological awareness, difficulty with sequencing and organization, and difficulty with time management. Not all people with dyslexia will have the same symptoms, and some individuals may exhibit strengths in other areas, such as creativity or problem solving. Here are some of the symptoms in preschoolers, in grade schoolers, symptoms after elementary school, and symptoms in adults. Dyslexia symptoms in preschoolers. Dyslexia is typically not diagnosed until a child begins to learn to read, which is usually around the age of 6. However, there are some signs of dyslexia that can be observed in preschoolers. Common symptoms of dyslexia in preschoolers include having trouble recognizing letters. For example, they mistake T for D. Mispronouncing familiar words. Baby talk is common. Finding it hard to learn or remember the letters of the alphabet. Being unable to recognize rhyming patterns, like Humpty Dumpty sat on a wall, Humpty Dumpty had a great fall. These symptoms alone are not a diagnosis of dyslexia, and that many preschoolers may exhibit these symptoms at some point in their development. If a child exhibits persistent difficulties with these skills, it may be worth seeking an evaluation from a qualified professional to determine if further assessment or intervention is needed. Dyslexia symptoms in grade schoolers. Symptoms of dyslexia in grade schoolers include: write slowly. Write letters or numbers backwards, such as B instead of D. Can't tell the difference between certain letters or words. Read more slowly than other kids their age. Can't always understand what they've read. Struggle to follow a series of instructions. Misspell words, even easy words like and dog. Have trouble sounding out words when they read. Say that words on the page appear to blur or jump around. Don't connect letters with the sounds they make. Ba for B or M for M. Again, it is important to note that these symptoms alone are not a diagnosis of dyslexia, and that a formal assessment by a qualified professional is needed to diagnose dyslexia. Dyslexia symptoms after elementary school. Dyslexia can continue to affect individuals throughout their lives, even after elementary school. Some common symptoms of dyslexia in adolescents and adults include: speak slowly. Can't remember the names of words, so they might say or a lot. Have messy handwriting. Have trouble writing clearly, like make errors in spelling, grammar, and punctuation. Take a long time to finish their homework or complete tests. Use the wrong words, like furnish instead of finish, or lotion for ocean. Avoid reading aloud. Dyslexia symptoms in adults. Dyslexia is a lifelong condition, and its symptoms can persist into adulthood. Some common symptoms of dyslexia in adults include taking notes or copying things down, spelling, memorizing or remembering words, reading at good pace, or engaging activities that involve reading, doing math, learning another language or remembering numbers such as passwords or PIN numbers, staying organized and meeting deadlines, understanding common sayings or jokes that involve putting a different meaning to a set of words like, in the home stretch, or, a bird in the hand is worth two in the bush. These symptoms can vary from person to person, and that many adults with dyslexia may also have strengths in other areas, such as creativity or problem solving. A formal assessment by a qualified professional is needed to diagnose dyslexia in adults. What are the treatments for dyslexia? There is no cure for dyslexia, but there are several treatments and interventions that can help individuals with dyslexia manage their symptoms and improve their reading and writing skills. Here are some common treatments for dyslexia. 1. Multisensory reading instruction. This type of instruction uses multiple senses, such as touch and sound, to help individuals with dyslexia learn to read. This approach often includes phonics-based instruction and may involve using specialized programs, such as Orton-Gillingham or Wilson Reading System. 2. Assistive technology. Assistive technology, such as text-to-speech software or speech recognition software, can help individuals with dyslexia access written information and communicate more effectively. 3. Accommodations and modifications. Accommodations and modifications, such as extended time on tests or the use of audiobooks, can help individuals with dyslexia succeed in school and in the workplace. 4. Cognitive behavioral therapy. CBT can help individuals with dyslexia manage feelings of frustration, anxiety, or low self-esteem that can accompany the condition. 5. Vision therapy. Some individuals with dyslexia may benefit from vision therapy, which involves exercises and activities designed to improve eye tracking and coordination. 6. Educational therapy. Educational therapists work one-on-one with individuals with dyslexia to help them develop reading and writing skills and to address any underlying learning difficulties. Treatment plans for dyslexia should be individualized to meet the specific needs of each person, and that a team of professionals, including educators, speech therapists, and psychologists, may be involved in developing and implementing a treatment plan. If you think you have dyslexia, reach out to your healthcare provider for a referral to a specialist who can help diagnose your difficulties.